So we have orders here for Mr. Johnson for an NG tube. First thing we're going to do is we're going to verify our orders, make sure it is for an NG tube, make sure it is for Mr. Johnson. Once we verify those orders, I'm going to gather my supplies together. So I have my NG tube, I would have a cup of water with a straw, a basin for in case he vomits. I would have a couple of syringes and a flush and some lube. Got my stethoscope here, some tape. Also have my gloves. So got my supplies. I'm gonna go in, introduce myself. How you doing, Mr. Johnson? I'm Kyle. I'm your nurse. We have orders to insert an NG tube. An NG tube would be inserted if you have like a perforated bowel, a blockage, like intestinal bleeding, if you're constantly vomiting. This tube is going to go down your nose, into your stomach. It's going to be able for us to give you either nutrients like internal feeding, or we can give you medicines directly to your stomach through this tube here. Now verify your name, date of birth for me, and verify that with your wristband and the MAR. I'm gonna wash my hands, put on my gloves. Ask you any questions. Make sure he's sitting upright, high flowers position. If he doesn't have any questions for me right now, first thing we're gonna do is we're gonna measure out our tube. So we've got my NG tube here. First thing we're gonna do is we're gonna measure. Make sure we have the correct length. So I'm just going to expose his stomach here. Okay. So I'm going to measure from your earlobe to your nostril here, and we're going to go down. We're going to go to your xiphoid process, which is right below your rib cage. Go a little shorter. Okay, so let's say that right there for your xiphoid process there. Once we have it measured, next thing I'm going to do is I'm going to have a pen light. I'm going to inspect his nostrils here. So look for any obstruction, any bleeding, deviated septum. Ask him if they had any recent brain surgery. If they had recent brain surgery, if they went through a nostril, it will be contraindication. The next thing we're going to do is I'm going to close one nostril and have him take a breath. The same thing with this nostril. And we're checking for patency, the nostril with the best airflow. That's the nostril that we're going to use. So say it says left nostril here. So we're ready for insertion. I'm going to lube up my first 3 inches of the tube here. Make sure he's ready. If he's okay, we're going to go ahead and get ready for insertion. I can curve the tip of the tube if we need to. Go ahead and insert downward towards his ear. And once I saw it, have him open his mouth. Once I saw it in the esophagus here, I would have him tilt his head down to his chest. I'd have a cup of water with a straw. Have him take a couple of sips for me. While he's swallowing, I'm going to slowly keep inserting until we reached our taped marker here. Once we reach our tape marker up to the nair, we're going to secure it in place with some tape around his nose or commercial securement device. The next thing we will do is we're going to do our 3 placement checks. So first one we could do would be we're going to do the whoosh test, which would be where we take a syringe, 10 to 20 cc syringe, and we're going to inject air into the tube. And while we inject air, I'm going to listen for bowel sounds, listen for a whoosh sound, again, up in the epigastric area. we hear that, then it's a good sign that it's in the stomach. Another test we could do, we could aspirate some stomach contents. Use that with a pH marker. pH should be at least below 4. That would be a sign that stomach acid and where we are in the stomach. And then for our final check, we would do an x-ray, make sure it's not in his lungs, it is in the stomach. We'd also flush after aspirating the saline syringe, flush out the stomach contents so it's not sitting in the tube. Once that is all done, we're going to secure it to his gown. We can hook it up to low flow suction. Make sure he's breathing okay, he's not in any pain or anything or discomfort. See if he has any other needs for us. If not, we're going to document the NG tube was placed successfully, low flow suction. If there's numbers on the tube here, we document what number is at the nair. So when we rechecked it, if it was high, if the number was changed, we know it either got pulled out a little bit or a little bit further in. If he has other needs, then the tube is complete, or test is complete, and we are done.